Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Mwaka. Here are first some of the highlights. Delta State Governor Dr. Ifeanyi Okowa, his wife Edith and daughter test negative to the coronavirus. Anambra State Governor directs police to arrest fake COVID-19 task force operating in the state. And confirmed global infections since the outbreak began passes 13 million, according to the Johns Hopkins COVID-19 Resource Center. The Nigeria Center for Disease Control, NCDC, announced 595 new confirmed cases and 4 deaths in 24 hours. According to the center, till date, 33,153 cases have been confirmed, 13,671 patients discharged, and 744 deaths have been recorded in 36 states and the Federal Capital Territory. The 595 new cases are reported from 19 states and the FCT, Lagos having 156, Oyo State 141, the FCT 99 cases, Edo 47, Kaduna 27, Ondo 22, Rivers 20, Osun 17, Imo 13 cases, Plateau 10, Nasarawa 8, Anambra 8, Kano 5, Benue 5 as well, Borno 5, Ogun 4, Taraba 3, Gombe 3 as well, Kebbi, Cross River 1 each. Lagos, Oyo, Edo and Kano states have recorded over 1,000 COVID-19 recoveries. The Delta State Governor, Dr. Ifeanyi Okowa, has tested negative to the coronavirus. In a tweet earlier today, the governor broke the good news, saying, "My wife, my daughter, and I have tested negative for COVID-19, along with other members of the family. We give God all praise and wish to appreciate all who have interceded for us in prayers." The governor also used the occasion to appeal to all residing in Delta State to obey all the instructions, the regulations in the collective fight to stop the transmission of the virus. Delta State so far has recorded 1,359 confirmed COVID-19 cases. 745 of those are on admission, that is, they are active, while 583 have been discharged. In the meantime, more survivors of the coronavirus pandemic in Delta State are still narrating their experiences on how they battled and conquered the virus. Some state top government officials, the Commissioners for Information and his special duty counterparts who tested positive to the virus, told their stories advising Deltans to adhere strictly to the laid-down guidelines as directed by health authorities.
You may have symptoms that look like malaria in terms of maybe fever and the likes, but there are a number of other symptoms that are not very, very peculiar to malaria. I have never had cause to lose my sense of smell, and so when that happens and you discover that no matter how ugly anything around you is in terms of smell, taste, you find it very difficult to understand. And then also you begin to, if you don't take care of your respiratory tract and your respiratory system, the tendency that you are likely going to find it very difficult to breathe.
For me, I was COVID positive. I went through it, and I'm healed and healthy, and I'm out of it. So they should use me as a case study. Im of where they sick every day. If you feel survivor, why not be there? Im of where we get your own sickness before. I am 9 years old in taking blood pressure drugs. 9 years. Consistently. So if I can go through that and come out, then any other person can go through it and come out. It is not a death sentence.
Another state official who contracted the virus, the secretary to the state government, Mr. Chiedu Ebie, recounts how after trying hard to apply necessary precautions, he was still surprised as to how the virus got into his system. He also speaks on the efforts of government to combating and containing the spread of the virus.
I think the first thing was I had a sore throat. Now, over time, I've always had a history of an inflammation of either my tonsils or so. I thought, oh, maybe this is just one of it, you know. And so, but from a sore throat it then manifested, went into a general feeling of a lethargic feeling or a feeling of malaise. So you were just tired. And I remember lying in bed for a couple of days. So I would say I had all the symptoms, but the worst symptom, I didn't have any breathing difficulties, which I'm thankful to God for. And then I also didn't have a cough. But every other thing, did I lose my sense of taste and smell? Yes, I did. Did I have fever? Yes, I did. I was sweating profusely at night. I mean, on 2 occasions, I had to actually wake up in the middle of the night. And this sleep was not, it was very, it was always interrupted, and changed because I was sweating profusely. Did I have diarrhea? Yes, I did. I had that as well. So it's not just a nice feeling, where you're feeling very unwell. And so, of course, when that happened, I called the Commissioner for Health and said, well, I'm not feeling too well, and I think I need to do a test. And so, as I say, the rest is history.
Survivors there on their experience of COVID-19. Let's take you to Niger State, where 327 more Almajiri children have been evacuated from the state following the increase of the virus in the state. 2 of the children are said to be from Ghana, while the remaining others are from 15 states across the country. According to the state's Ministry of Education, 12 Almajiri have so far tested positive to COVID-19. Is our correspondent, Emperor Simon. He tells us more.
Still on the evacuation of Almajiri from Niger State. This time around, we have over 327 Almajiri children that will be evacuated from Niger State to other states in the country, particularly in the northern region.
The reports we have now, out of the 327 we have, about 12 of them have tested positive, and they are actually in the quarantine center being well taken care of.
We spoke with the Director General, Niger State Child's Rights Agency, on what the agency is doing to ensure that parents buy into what the state government is doing.
When we go to reunite the children with their parents, we don't just go and dump the child. We actually have a small community setting there whereby we educate the parents and tell them the dangers this poses to the children, and where the government is being focused on trying to achieve the end goal.
Niger State currently has a total of 145 confirmed cases of COVID-19, and 12 out of that number are from these Almajiri children. From the Niger State Arch Camp in Minna, Emperor Simon for COVID-19 update.
Staying in the northern region, over in Bauchi State, our correspondent Hajar Ali brings us this update on the state's response to the coronavirus.
COVID-19 pandemic has exposed the soft underbelly of the nation's poor healthcare delivery system. It exposed the glaring inadequacies in both personnel and facilities. Is it just the gloomy side of the pandemic that has been witnessed, or are there good sides of the pandemic on the healthcare delivery system? To speak about this is Dr. Yusuf Abdumiso of the College of Medical Sciences, ATBU Bauchi. Doctor, I want you to narrow your thoughts down to Bauchi State. What is the impact of this pandemic on the healthcare delivery system?
Okay, thank you very much, Hajara. With regards to the impact of this pandemic on Bauchi State Health System, I would say we look at it in 2 ways. Positively speaking, we have a large, massive resources coming in order to support the seemingly weak health system. Millions of naira has been injected right now in order to increase the capacity of the health system, generally speaking. We have more resources in terms of facilities. The State Ministry of Health, for instance, now, it has a robust EOC which helps coordinate response to public health emergencies. I want to say that this will go beyond the COVID-19. Even after the COVID-19, some of these facilities, some of the resources are going to be utilized. They are going to be extended in order to respond to any other public health emergency that may come about.
Okay, what are some of the negative impacts of the pandemic on the healthcare delivery system in Bauchi State?
Some of the negative impacts on the pandemic is that we have seen increase in mortality and morbidity due to the non-communicable diseases. Things like hypertension, things like diabetes have not been receiving adequate attention in the last 6 months from January to date. This is because there has been reassigning of staff and resources to the COVID-19 pandemic response. And that leads to some elements of neglect of the non-communicable diseases. And if you look at the WHO reports, this is a global problem, not just Nigeria. But of course, we have witnessed it in Nigeria, for instance, in Katagum, local government of Bauchi State. We've seen some increase in death rates around the same time that WHO investigation has linked it to some neglect of these non-communicable diseases such as hypertension, diabetes, and other things like that.
Thank you very much, Doctor. That's the updates we have for you from Bauchi State. Hajara Aliu for COVID-19 updates.
Dr. Johan Akase, a consultant infectious diseases expert, he joins us to analyze the pattern of the virus in the country. He joins us via Skype from Media Rabat. Thank you so much for joining us at this time. I'd like to begin with where you are, and that is Luth, I believe, and ask about the response from your end.
Well, thank you very much for having me. The response has been quite demanding. Looking back as a whole, we can see how timely to respond in a timely manner can forestall a number of deaths. We in Luth, the management of Luth did take a timely decision to institute processes to train and to respond appropriately. And indeed, starting from our staff and people in the surrounding community, it has been a huge success story. From the Luth, as far as Luth management is concerned, and the way they responded in a timely manner with the support of Lagos State government. Yeah, so it's a good one really from our side. Yeah.
We've been told about the community spread of the virus, and there is the evidence suggesting the possibility of the airborne transmission, which cannot be ruled out. How do you think this affects us in curtailing and curbing the virus at the community stage?
Okay, so in terms of the thing about COVID-19 is that once we all knew that once it broke into the community, it was always going to be difficult to contain. And in terms of preparation, I know the NCDC and all government facilities had anticipated that there will come a time when the virus will be in the community. Right now, the aim is to mitigate the effect of the infection on people that present to our facilities. In other words, we know now that we cannot contain everybody in an isolation facility anymore. So what we intend to do is to look at those ones that are coming sick, that have risk factor for severe disease, and as much as possible provide the kind of medical care they need, to carry them through, through that, while still proceeding with public health measures to reduce transmission at community level. But we now know that we don't think we'll be able to contain the virus only within certain communities, because really community transmission has become quite extensive, almost everywhere in the country at the moment. Yeah.
Do you expect that precision lockdown can work for those high burden communities?
Yes, I would say yes and no. Yes, in a sense that the aim really, and which is what has always been said, is to, as much as possible, try and flatten the curve. That's other words. So, reduce the number of cases that are coming in at a point in time. Lockdown in the country, we knew how that went, and reinstating lockdown at the moment is, I think, it is my opinion, is going to be counterproductive. Because we know people didn't comply with it the first time. And we know that economic realities and other security challenges didn't allow for a successful lockdown. Now the virus has even gone extensively within, and lockdown has its own role in limiting access. Some people who are very sick, there are limitations in terms of transportation, access to moving to health facilities when they do need it. So personally, I don't think lockdown, at least the sort we had, is what we need to do at the moment. I think we need to just activate processes to make sure that we respond appropriately when issues come up, while still advising, the public to adhere strictly to the rules and the advice.
Safety protocols.
Yeah.
All right.
Yeah.
We appreciate your time. Thank you so much, Dr. Johan Akase, consultant infectious diseases expert. Thank you for joining us.
Good to be here. Thank you. Yeah.
We have more on the COVID-19 updates when we return. Please stay with us. Welcome back. The Anambra State Governor has directed the police in the state to arrest anyone posing as a COVID-19 task force operating in the state. The governor disclosed this in a special broadcast at the Governor's Lodge on Onitsha while updating on the latest development in the war against the spread of COVID-19. According to him, the Anambra State Police Command is to search out and arrest criminal elements for onward prosecution. The fake COVID-19 task force operators have been reportedly arresting people, extorting huge sums of money while posturing as working for the government.
In Anambra, I've been reliably informed that a group of criminals parading in fake COVID-19 task force uniforms have been arresting people and extorting huge amounts of money from them while posturing as working for the government of Anambra State. These strict stars are reported to be very active in places like Onitsha, Mpo, Obosi. I wish to make it categorically clear that the only agencies authorized to enforce the Anambra State COVID-19 law are the members of Ocha Brigade, ATMA, that is Anambra Traffic Management Agency, and the trained agents in all our markets. Any other agency or group of people masquerading as COVID-19 task force on the streets of Anambra State is fake. And I want to quickly warn these fake operators that the Nigerian police force has been directed to search for and arrest all those and prosecute those criminals.
According to Dr. Tedros Adhanom Ghebreyesus of the World Health Organization, we're seeing dangerous increases in cases in countries where proven measures to reduce risks are not implemented or followed. We have Nurat Ajenifuja, a pharmacist, and she joins us on the program from our Abuja studios. We'd like to thank you for joining us on the program. And first ask what your thoughts are on the Nigerian people, the actions and also the actions of government to the public enemy number one, COVID-19.
Thank you once again. Yeah, the government is responding well, but more needs to be done. For instance, we've been hearing investigation are showing that it could be airborne. So constant decontamination of the environment will go a long way to reduce this pandemic. So I think the government needs to do more. A lot has been done, but we still need to improve on it because it's a novel virus. So many new things are popping up here and there about the virus. So we still need to do a lot more to curb this pandemic.
Do you think there's enough public trust, and this is in government's attempt to bring the virus to flatten the curve of COVID-19?
Sorry, please come again.
Would you say that there's public trust in government's efforts to the response?
When it comes to public, there are bound to be exceptions. Not everybody will agree, but at least to a certain level, especially when you come to the government hospitals, you see the measures on ground, and you know that okay, government is doing something about it, and this boosts the public trust. But when we come to the community level, I think more still needs to be done in curbing this pandemic. The government presence has not really been felt more in the community until when you come to government institutions, when you see the measures being put in place. But in the community, a lot still needs to be done, especially like in our marketplaces, because there are most of the markets, you don't see them checking temperature. Some people go around without the face masks. There's no the contamination of the marketplace every day. This has to be done every day for us to be able to nip this in the bud. So to gain the public trust, I think the government needs to do more again in that regard.
So I guess the basics must be followed. But finally, in terms of our vaccine and treatment search to handling and properly managing the virus, a leading scientist in the UK is warning that there's no certainty that any of the vaccines currently being developed will be successful, and that is somewhat dependent on the level of immunity needed to prevent the infection. What's your take on this?
I think we'll be jumping the gun to give a verdict on this. Let the vaccine come out first, then, because this needs to go through clinical trials, and this takes a long time before you can certainly say this is really going to provide immunity to the person that uses it or not. So we'll be jumping the gun by doing that. Investigation and researches are still going on. So after the researches, then we'll assess the situation and see if this assertion is true or not. But if we are going to base this evidence on previous vaccine, like the influenza vaccine, it's working well. At least for 6 months, it covers the patient that uses it for 6 months. The patient won't come down with anything influenza. So with that, we can collaborate that with the new vaccines going on, that it can work for it, but we can't really say for certain if this will be, because this is a novel virus, so everything about it is new. We can't really just say that it might work or it might not work until the vaccine has been put in place and the clinical trials have been done. Then after that, assess the situation to see if it has really done what it has been purported to do.
We appreciate your time on the program, Mrs. Nirat Ajenifuja, a pharmacist. Thank you for joining us at this time.
Thank you for having me once again. Thank you.
In the second phase of managing the spread of COVID-19, the Cross River State Government has continued to enlighten the public on the importance of adhering strictly to all protocols set aside by the federal government, and this time through music and dance. Speaking in Calabar, the Cross River State capital, the only female carnival band leader in Africa, Senator Florence Itagewa maintains that the state is known as a carnival state, which has always been a way of passing very important messages through music and dance steps, hence the need to create an awareness campaign on the COVID-19 protocols using this medium.
We just thought that we cannot fold our hands, see what is going on in the world, sad as it is, without contributing and helping send the message of awareness through dance. So we are trying to kill 2 birds with 1 stone. First of all, create the awareness, because there's nothing that attracts attention than dance and music. So we use dance and music to create awareness. And then number 2, to also help elevate people's, dampened mood, because the world is so sad right now.
Every strategy is important in, of course, spreading the awareness. Well, let's go over to the international scene, where France has approved pay rises worth 8 billion euros for health workers, with the government acknowledging their role in the pandemic fight. A deal was signed with trade unions after weeks of negotiations, and will see wages rise by 183 euros a month on average.
French Prime Minister Jean Castex and union representatives have signed salary increase agreements for hospital staff, part of a historic budget deal for the healthcare. A deal will clear 7.5 billion euros to increase the pay of healthcare workers, an announcement that came after 6 weeks of discussions between the government and the unions. California's Governor Gavin Newsom ordered a massive retrenchment, even as the state's reopening, shutting bars and banning indoor restaurant dining statewide, and closing churches, gyms, and hair salons in hardest-hit counties. Newsom's move, which undoes weeks of reopening efforts in parts of the most populous U.S. state, comes as several rural counties are experiencing strains to their hospital systems, while cases mount in large metropolitan areas, including Los Angeles and parts of the San Francisco Bay Area.
Visit the NCDC website. It has regular updates on the COVID-19 regulations and guidelines with all the information, statistics on cases across states. It says that every new case is motivation to keep pushing. Each recovery is proof that we can get through this together. Take responsibility. It's the same message from the World Health Organization. Your questions are answered on the coronavirus disease situation dashboard with cases of countries around the world. Our website, channelstv.com, has the latest news. All you need to do is log on, access stories just coming in, the breaking news stories, also more on the pandemic, Africa, and of course news coming in from around the world. That's the COVID-19 update. Thank you for watching. I'm Millicent Wonwaka. Bye for now.